All right. Hi, Sam. How are you doing today?
I'm good. How are you?
I'm okay. Um, so how have you been since the last time that we spoke?
Um, I've been doing okay. So I have been going into work because my boss told me I had to,
Uh-huh.
or he was going to fire me. So I have been kind of like popping in and out um of work. So I've been going, oh my god, when did I go last? Was today Friday? I went, so Monday I went in the morning because we had a meeting.
Uh-huh.
We had a work meeting. But with all the COVID stuff going on, they want some of us to be into the office, some of us to work from home, and the ones that are in the office, the other people need to work from home, and vice versa, right?
Right.
So so I went in on Monday for a meeting, and then in the afternoon, I had to work from home. And then I didn't have to go into the office on Tuesday, but I did some work in the morning. Um, and then I didn't go in Wednesday, and then I went in Thursday and today for a few hours. So here I am.
Well, it's good. I mean, it seems like you've uh taken a little bit more initiative, even though you were kind of given an ultimatum, come in or not have a job. But
Right.
at the same time, that could have went the other direction. You could have been like, "Yeah, well, I don't really need the job. Fire me and I'll collect unemployment."
Right.
So,
Right.
uh,
No, yeah, you're
yeah,
right.
that's great that you took that step and took that initiative and took it seriously. So, um, now you are working at home still, also, correct?
Yes, yes. I should be doing more work than I am, but I don't know. I feel like it's a lot harder to work from home, and that's kind of what I'm struggling with because, like, when I sit down and I'm like, okay, I'm going to do work, I'm going to get my mind right, I'm just going to do it. But then I think of all the other stuff I need to do here, and it's really hard for me to balance that. Like this morning, or no, Wednesday morning, I sat down at my kitchen table and then I realized like dishes were in the sink and I needed to switch out the laundry, and it's it's been really a struggle, and then like I kind of get sidetracked, and then like next thing I know it's like noon, then I'm kind of hungry, and then I start drinking again. It's been kind of rough.
Yeah, that was kind of my next question is, with you working at home, if the drinking had gotten any better, since you've been going into the office a little bit more, if that was an issue, still with you drinking at home.
So I have to say from our last session, like you really got me thinking about and kind of being more mindful of how much I'm drinking.
Uh-huh.
So you would be proud. Last week, this week, starting Monday, um, I actually didn't drink in the morning.
That's good.
So I've kind of been like, so I really wanted to start like this new routine because that was my routine. So like I would get up, have like a cup of coffee and then I'd start drinking. So I started kind of tweaking that a little bit. So instead of getting up and then having coffee, like I get up and get ready first. So I kind of like disrupt that.
Hmm.
But then like I find myself like now drinking like starting in the afternoon, but it's not as much.
That's good.
But if I'm at work, I don't, obviously. Like I don't do that.
Right. Right. Well, I mean, even that small tweak in your schedule, that's it's baby steps. You can't be expected to just quit, all of a sudden cold turkey, especially with alcohol. And what a lot of people don't realize is once your body becomes dependent on alcohol, and you stop suddenly, not only do you get the DTs and shakes, but you can actually die from withdrawal from alcohol.
I
There
didn't.
are there are two drugs that you can actually physically die from, and that is benzodiazepines and alcohol. You can actually die from withdrawal from both of those.
I
So
didn't know.
yes, so
So thank God I didn't stop cold turkey.
yeah, and I mean, I don't know exactly how dependent you are on it. Some people from the time they wake up till the time they go to sleep, they're drinking nonstop. They wake up, crack a beer, and that's just how the rest of their day goes. Obviously, that wasn't the exact case with you, and you do go times without drinking when you go into work. You said you don't drink and drive, which is a wonderful, wonderful thing, because so many people think, oh, I'm okay to drive, and
Right.
then they end up with legal issues, DUIs. They can hurt themselves, potentially hurt others.
Right.
So it's a good thing that you're mindful about the situation. So
Yeah. Yeah.
I
I
was I was looking at, I had filled out a assessment form after we spoke the last time,
Mhm.
and I was thinking at first that your main um, issue was alcohol related, just because of you saying, you wake up and have your cup of coffee and then you start drinking, or you're missing work, because you're drinking, or you get drunk the night before, you have no motivation to get up, so once we kind of dug a little bit deeper into that, the issues with your mom, um, you going away to college, becoming depressed, being on Lexapro,
right.
okay, being on the Lexapro, from a psychiatrist that you were seeing. Um, I believe personally that you are suffering from a persistent depressive disorder. And what that means is you're using the alcohol as kind of a crutch,
Mm.
as opposed to being medicated and seeking out professional help, for that depression. And so that the alcohol is kind of a byproduct of the depression. And with as much as you went through as a child,
Mhm.
and the issues that you're having at work and stuff, it's very easy to fall into that habit and to use alcohol or any other substances to make yourself feel better, and not really address those particular issues. So what are your thoughts on that? Do you now that I bring that to your attention, do you think that that might be something that's feasible?
Yeah. That it actually does make sense though. It really does. I didn't think of it that way where, my history and my past and like realizing like, yeah, I never really was a big drinker.
Hmm.
But I did suffer from depression, and with me being on Lexapro, I was maintaining that, but then I started feeling better, so I stopped it, and then I started drinking again, and then obviously that made me feel better. So I was really medicating myself with alcohol, and I still am.
Right.
It makes sense. So would you say that I have like persistent depressive disorder and alcohol use disorder?
Um, My thoughts are the persistent depressive disorder and an unspecified alcohol related disorder, because I
Mm,
don't necessarily think that you suffer from alcoholism, just for the simple fact that you can kind of you tend to use alcohol when you're depressed or when you're having a bad day. It's not something that your body is physically dependent on.
right.
It's not something that you have to have in order to function day to day. You can get up and go to work and not have a drink and perform your work just fine.
Right.
It's when you're sitting at home and you're depressed and you're not, you don't feel like doing anything, you're unmotivated, those feelings start to kind of sink in. That's when you seem to drink. Or when you don't want to be alone and you go out with your girlfriends because you want to socialize, that's when you seem to drink more.
Yeah.
So personally, that would be my thoughts on that situation. I just kind of wanted to get your input on that to see how you felt about that particular diagnosis.
Yeah. I mean, it's true. I just didn't think I had it again, you know?
Right.
So it's nothing new. So I guess that explains it. I guess, like my low mood and not wanting to get up. I just thought it was really because I was hungover and I hated work. Makes sense.
Okay. Well, with that in mind, then, if you're in agreement with that particular diagnosis, if you feel that is correct,
Hmm.
um, I would like to set some goals for you, to try to help over these next few sessions with us, um, to see where you would like to go with this, to see what we can do, um, to help you out, short term and long term,
Okay.
um, to with work, with managing life, to help you be able to enjoy things again
Right.
without the need to cover it up with alcohol. You know what I mean?
Right.
So, what is something, like a long-term goal? What is something that you would like to see yourself doing in a year?
Oh, a year. Not be dependent on alcohol. Like I just want to completely cut that out.
Okay.
Yeah.
And what are your thoughts on how would you want to go about doing that?
I feel like for me, I am like really routine based. And I
Uh-huh.
feel like that can contribute to a lot of my drinking, right? It's kind of like a force of habit. And I tend to like I was saying earlier, when I wake up, I have my coffee and then I would start drinking,
Right.
right? So for me, I feel like if I like tweak the routine like I have been, but even when I'm not working, not depending on that alcohol, right? So instead of like realizing, hey, it's almost lunchtime, and then thinking like I should have a drink, um, changing that. So I feel like I would need to like alter my routine.
What kind of other activities would you feel comfortable with, um, putting in place of that drinking? I mean, I know you said especially your really good friend, the one that brought the drinking to your attention.
Right.
Would you be, is it something that you could spend more time with her, or, um, you know, donate your time to like a girls and boys club, or, something along those lines to keep your mind busy, but at the
Right.
same time, keep you from picking up that drink again.
Right. So it's so hard because like I would have to So I get like meeting invites for work and stuff. So like tonight I don't have any scheduled meetings for next week. But
Uh-huh.
the problem is that, you know, come Sunday night or Monday morning, it's like, you know, meeting Tuesday morning at 11 or meeting at 3 o'clock on Monday that I have to attend. So it's so hard, you know, with the COVID stuff going on. I
Right.
find that, you know, my schedule is all over the place and I can't find consistency. And also, like, my girlfriend has a little kid, so we don't really see each other with this COVID thing going on. So I don't
Right.
really want to set myself up for failure. Like, hey, you know, like I'm going to go hang out with her when I know it's not realistic.
Right.
But I'm like, if this, you know, if the COVID wasn't going on, yeah, that would be realistic. So now I feel like I have to think about if I'm not at work and I don't have any meetings, what can I do? Right. So, and then like you gave me a good idea about the Boys and Girls Club, but the COVID, you know, and
Yeah,
it's
that's true
puts a
too.
damper.
I know it really has put a damper on a lot of things. I know that it's affected, myself and my family quite a bit too, especially younger kids. They just don't understand that, and
No,
it's so hard, they don't understand why they can't go hang out with their friends or do this or do that, and why the parks are closed. And
no. I
um
don't get that either, by the way, where the parks are closed.
what
That's for
about
another conversation.
right. Yeah, they've got police tape up over all of the parks and stuff in the area here. So it,
So,
it's terrible. But um,
so
what if,
yeah,
what
go ahead.
about um, what about maybe moving up, like in your corporate ladder? Is that, I know you kind of touched base on your job last session.
Right.
Um, you said, a lot of the people that you work with, they're into politics, they drive you nuts, which completely understandable. I have a few of those myself. Um,
Right.
but
Sure.
what about maybe picking up some extra work, or maybe looking for something that you can use your degree for that would be a little bit more appealing to you, to where you wouldn't feel the need to drink, that's something that would keep you a little bit busier and that has a little bit more consistent of a schedule. Have you thought about that at all?
I think that's a really great idea because, you know, with this COVID thing going on, you know, I've gotten so used to being at home and not really doing anything like with work and stuff. So I feel like I think it's really good that if if I have to go into the office on, say, on Mondays for meetings, and when I get home, continuing to do work, like staying in that work mode. But I feel like I don't know how I would motivate myself. Maybe I shouldn't sit at my kitchen table. Maybe I should actually like go upstairs to my office.
Which sometimes is easier said than done.
Right. Right.
It really is, because when you're already downstairs, and like you said, you've got or you got dishes that you have to throw in the dishwasher, or laundry that you have to switch over, it can be really frustrating. But what I have found helpful is to set a timer, not on your phone, but like one of those cooking timers that are really, really freaking loud. And you set it for an hour, and that hour you're going to stay in your office, and this is what you're going to do. You're not going to get up for any distractions until that timer goes off. This is what you're doing.
That's so smart. I think that is really good because then it's like, okay, I'm not committing myself to staying in my office for 5 hours to complete the work. It's reasonable, it's
Yep.
realistic, an hour, and then I can take a break. And
Yeah,
then
take a break, get up, stretch out, go switch out the laundry, grab something to eat, come back in, do it for an hour again. That way you're not burning yourself out, and that way you're not stressed out either to where you feel, I need a drink because I've been staring at a computer screen for 5 hours and now I have a freaking headache and I don't want to do it anymore.
It's so
You know?
true. Yeah, no, I think
So,
that's great.
so that's, I mean, just a thought.
No, I think that's great.
Um,
I'm gonna do that.
so for long-term goals, I was thinking, long-term goals are all fine and dandy, but we do need to set some short-term goals as well. And with what you had told me in our previous sessions, um, you were calling into work, with hangovers, or if you're working from home, you're drinking your coffee and then you start drinking alcohol. Um, for some shorter term goals, it sounds like you've already started on that with switching up your routine, which is
Right.
which is fantastic. Getting ready for the day instead of doing the coffee and then starting with the booze right away.
Right.
Get up, shower, get your stuff in order, and that way you're less likely to start
Right.
drinking earlier. um I was doing some research on the PPD or PDD, and a lot of stuff that I had come up with, um it shows that cognitive behavioral analysis and counseling seems to really help with to help um, alleviate some of the pressures and that stuff that you have kind of stored in the back of your mind. That anger towards your mom about not being there, and her being sober now, and her trying to be a parent, but now it's kind of too late, that ship has sailed, that kind of stuff. I didn't know if that would be something you're interested in, or if you had thought about maybe going back on a medication to help with that. Because I remember you said the Lexapro, right?
Yes.
I'm sorry, I need to write that down so I don't forget it again. But you said that really helped you, and you started to feel better on it, but then you weaned yourself off of it, and that's when the drinking started again, correct?
That is correct.
Okay. So what would your thoughts be on maybe trying another SSRI drug, something to that effect, that might help alleviate those symptoms, and that way you wouldn't feel the need to drink as much either, because there's SSRIs, the TCAs, the SNRIs. There's all different kinds of medications that help with that have minimal side effects, and you're not going to feel tired, you're not going to feel loopy, you don't feel out of it. But then that also kind of helps curve that need and that want to drink so much too. So I didn't know if that would maybe be something that you would be interested in, further down the road, or if you wanted to just try counseling and stuff first. So what are your thoughts on that?
I think it would be a great idea to get on, an antidepressant, and then, continue with therapy.
Mm-hmm.
Um, just to kind of get more stabilized, in the
Right.
sense of, like I just don't want to set myself up. And I already know that it's worked in the past.
Mm-hmm.
So it's like, okay, yeah, like granted, my, I mean, things could change, right? And the
Right.
way, our bodies are, our hormones and everything. And yeah, maybe 10 milligrams of Alexapro isn't going to be enough, but just seeing what it does and just taking that step along with therapy, um, I think would really help me at this moment.
Okay.
So yeah, I think the SSRI
Would be something you'd be interested in.
yeah.
Okay. Um, now, uh, with the SMART goals, okay, we've kind of done a specific on exactly what the issues are.
Yep.
Measurable, how will we measure your progress and effectiveness of the intervention? That would be helping you reduce your drinking, helping you to better yourself at work, um, getting stuff done, going in when you're supposed to. Um, it would be attainable, so long as you kind of stick with the program.
Right.
And as far as time bound, when when would work for you to try to start with that course of action? I mean, what would be good for you? Because I know you got a lot going on, and right now, with the whole COVID-19 thing happening, it's kind of hit and miss on when you're going in and out of work and whatnot. And I'd hate to start you on a medication and then you have some adverse side effect to where you have to miss more work. You know what I mean? So it's just what what would be ideal for you?
I think I think this week would be a good time to call my PCP
Okay.
and then, talk to her about potentially getting on an SSRI,
Okay.
because I think it would be actually like really beneficial, honestly, because they're doing telehealth,
Mm-hmm.
like kind of like what we're doing.
Right.
So if she has availability, regardless if I'm at work, I can schedule the doctor's appointment on the phone, during my lunch or during a break. And I think I think that would be good. So I think it would be good. I think it would be effective if I did it this week and then start the medication by
Okay.
the next time we meet.
Okay. Yeah,
Monday.
that sounds like a great idea. Like I said, I was kind of leery about bringing it up just because I know that you had said, you tried the Lexapro before and it worked, but then I wasn't exactly for sure the reasoning of you stopping taking it. I know that you said you were feeling better, so I didn't know if that's why you stopped taking it or
Well,
if there was
yeah,
other
I guess.
reasons behind that.
Yeah, I guess. Yeah, I started to feel better, but I also was like young and naive, like, oh, this medication makes me feel better, and like that's it, and I can stop it. Not necessarily,
Need to continue it. That's why you're feeling better, is because you're on it and
right,
it's helping balance the chemicals in your brain correctly.
right, right.
Gotcha. Okay. Okay. So this week then the plan is for you to contact your PCP and get something set up with them and see, what would be work best for them, and then we can kind of um, touch base and see where you're at on that,
Mhm.
and then continue your counseling sessions and stuff with me as well after you start on that, because
Yeah.
those usually take a couple of weeks to build up in your system. So
Mhm.
of course, it's not going to be an instantaneous thing, just so you know.
Okay.
Um, so if that works for you, then I think that sounds like a great plan, long term and short term.
Right.
So,
Right.
um, also, I wanted to discuss with you. They have and I don't know if this is even necessary for you, but they have medications out now that for people who want to stop drinking but can't.
Okay.
And I'm not for sure, I don't think that that's necessarily the case for you, but it's a medication that you take, and if you drink any alcohol, then you get really, really sick. Um, so I didn't know if you wanted to try the SSRIs first to see if that helps curb the alcohol. And if it doesn't, maybe then we can go that other route to try to get you, away from the alcohol a little bit more, and help treat that depression first.
Yeah, I think that would be good, just to kind of have like a backup plan.
Right.
Um, so we'll do the SSRIs, see how that goes. Um, Also with counseling, and if I feel like still the urge to drink, then maybe we can kind of process that, and then I can talk to my doctor about
Right. Well,
that.
and it's not a one size fits all thing either. There are several different combinations of medications, that it may take 5, 6, 7 months to get you on the right dosage that's going to make you feel right and back to normal.
Right.
So it's going to be kind of a roller coaster ride for you, but it'll definitely be worth it, and I'll be here for you, day or night, anytime you need to talk, or any issues that you have. You can contact me, and we can work through it together.
Thank you. I appreciate that. Yeah, this is going to be a tough, exhausting journey.
Yes,
Not drinking.
absolutely. But you've already taken the first step, and even though the step was because your boss told you, you either needed to start coming in, or you're going to lose your job.
Right.
Sometimes it takes that ultimatum to
Right.
do what is ultimately right. I have a lot of clients, that they were given ultimatums, and it finally made them realize, hey, I do have an issue, and I
Right.
really do want to work on this. So that's a wonderful thing.
Yeah, I think I needed that. I
Good.
feel like I
Need
needed
that
to
little
be held,
push.
yeah, and to be held accountable,
Yep.
you know?
Absolutely.
Yeah, I
So
think I needed it.
good. Good, good. Well, that is wonderful to hear. And go ahead and contact your PCP this week about getting on some medication for that. And then we will just continue with the talk therapy, for to kind of dig in a little bit more on, your childhood and all that kind of stuff, and see if we can maybe get some of those issues resolved, with your mom and whatnot, and kind of go from there, and see if that helps you out a bit too.
No, I think that would be great. Thank you so much. I really appreciate it.
Sure, no problem. So we'll talk soon then.
Of course. We'll
All
see
right.
you.
All right. Thank you.
Uh-huh.
Bye bye.
Bye.
Okay. So
Are you recording the feedback?
yeah, I'm gonna record the feedback just for myself.
Okay. No, I think you did great. You're super organized. You really took a lot of so it's really hard to play a character when I'm like twisting things,
Uh
and I
huh.
have to talk a lot.
Uh huh.
Um, but like you remembered things that like I completely forgot I said,
Okay.
so like your memory is awesome. And I think you touched base on a lot of great material. There's no concerns.
No.
Nope.
Really, you're not just being nice to me?
No.
Because you better tell me the truth, woman.
No, so I've personally have experienced like a therapist that talks a lot and is like conversational, and
Uh-huh.
then another therapist who is like more quiet and more like straight person centered, client centered.
Right.
I mean, I like both,
Hmm.
um, but I prefer like the counselor to talk to me, and not just sit there and like use reflections and summaries. And it's like, I know what I said, you know?
Right. Right.
Um, no, I thought that was great. And it was like great rapport building. Yeah, no complaints.
Okay.
You're going to make me stop drinking.
Yay!
Even though I have like my wine collection up there.
You know what's funny is you were drinking out of your coffee cup, and I was gonna say, so what are you drinking there? After you said something to me about the last video, you're like, I'm surprised you didn't ask me what was in that cup, because you're sitting at home.
Yeah, not driving to my therapy appointment.
Oh, that's too funny. Cool.
No, it was really great, really great.
Good deal. All right, well, I'm gonna